These guidelines are to support vessel health and preservation and should be applied to all adult patients. It is designed to allow us, as healthcare professionals, to make sure the right patient receives the right device at the right time. This short video will explain how we can apply this to our practice, ensuring our patients receive the device that is suitable to their need and treatment plan. Preservation of vessels is required to minimise damage such as thrombosis, stenosis and infection, and maintain patency of peripheral and central veins for future use whilst minimising any patient discomfort. The first consideration is the most fundamental question. Many patients receive IV therapy when in fact there may be an alternative route of delivery that can still provide the desired clinical effect. Remember that IV therapy can be associated with significant risks and morbidity as well as poor patient experience. The next step is looking at the right device decision-making tool and is a core element of this framework. This tool is a number of simple assessments based on the patient's vein grade and proposed IV treatment. The first part of this tool is to question whether the treatment must be given centrally. If this is the case, there is no need to assess the vein grade of the patient's peripheral veins. You can simply move on to select the relevant vascular access device based on the patient's proposed duration of treatment and other patient factors. Many drugs require central administration to prevent damage to the peripheral veins, as the flow rate of a peripheral vein is considerably less, around 10 mL per minute in comparison to anything from 800 mL to 1.5 litre per minute centrally. Factors such as pH, osmolarity, the size and fragility of the peripheral veins need to be considered. Medusa is the online injectable management guide where drug information is available. It also recommends the best route of administration. If the particular drug can be given peripherally, the next stage is to assess the patient's vein grade. The vein grade identifies the quality of patient veins ranging from A, excellent, 4 to 5 easy identifiable veins, to E, non-visible veins of the hand and arms, even with the use of an ultrasound or vein finder. This will ensure that the proposed duration of treatment can be safely administered via this route without causing damage from multiple cannula attempts, delay in treatment whilst gaining access, and promote patient's comfort. Regardless of peripheral or central administration of the drug, the final step of the process is to look at the proposed length of IV therapy. It may be necessary to choose an alternative vascular access device that is suitable for a prolonged course of treatment that benefits the patient. Another important consideration, and one that may have a big impact on the final device, is that of our patients. It is important that any vascular access device chosen is done, where possible, in conjunction with our patients, ensuring that this is a truly patient-centered choice. The final element to this framework promotes daily reassessment of the chosen vascular access device. This will ensure the device is still appropriate, preserving vessel health and comfort to our patients. The assessment should consider any complications and if the device is still required.